agentic AI is sort of one of those terms that can sound maybe bigger or scarier than it actually is. I think one way I like to sort of ground this is by talking about the different levels of agentic AI, because not everything that gets labeled AI is the same exact thing, right? So if you look at, like you'll say level one. So level one is sort of deterministic automation, right? These are rules-based systems. If this happens, do that. And honestly, that's where a lot of Softheon's value has come from over the past, 25 years, right? These sort of highly reliable deterministic systems that do exactly what they're told every single time. And I would say most healthcare systems in production today, back to your point earlier, right, are still living in this very comfortably at level, one, where it's, AI may not be making these sort of decisions, for them. Level two is where things I think get more interesting, right? These are systems that can detect patterns. They can classify work, make recommendations. But generally speaking, you still want humans to decide, from there. And that's where we're seeing a lot of growing companies experimenting right now, right? Still a small number, but certainly, definitely a moving part of the market. Then you get to like level three, right? That's where you start seeing this like early agentic behavior, right? Systems that can plan steps, adapt to changing conditions and actually propose actions across different workflows. And there's relatively, if you look at Gartner, studies and things like, there's relatively few organizations that are truly operating this in a regulated environment like healthcare. And again, I think that's for good reason. And then you get to level four and level five, and we're not really there yet, but right, that's what people imagine, right? The super like high autonomy, self-directed systems, right? A lot of, if anybody's doing anything here, it's like sort of research, pilot programs, right? These really constrained domains where that risk is not necessarily a concern for them. But in healthcare and government, right, that's not where the market is. And frankly, I don't think it should be, where it is.